Welcome to the 78th Annual General Body Meeting of the Catholic Health Association of India. The theme for this year's AGBM is Resilience, Compassion, and Quality Care during COVID-19. I am Anuvinda Barki, your host for today. I work with the Christian Coalition for Health, which is a coalition of CHAI, the health arm of the Catholic Church of India, Christian Medical Association of India, the health wing of the National Council of Churches of India, the Protestant Church, Emmanuel Hospital Association of India, the health wing of the Evangelical Church in India, and the Christian Medical Colleges of Ludhiana and Vellore. When Father Matthew asked me to host today's meeting, I gladly accepted, as it would give me the opportunity to meet and listen to the immense work that you at CHAI have been doing under very difficult circumstances of the pandemic, and how you have done your work with resilience, compassion, and providing quality care to your patients across the economic, social milieu of this country. So thank you, Sister Victoria, Father Matthew, and CHAI for giving me this opportunity and privilege to be your host today. Sister Victoria Narichetti is the President of the Catholic Health Association of India. She has served in the healthcare mission for over 30 years. She has completed her MSc in nursing and her PhD in hospital management. She is currently the principal cum professor at the St. Joseph's College of Nursing, Nalapaddu in Guntur. I now call upon Sister Dr. Victoria Narichetti, the President of Catholic Health Association of India, to give the opening address.
Thank you, Ms. Anuvinda. A graceful good morning to all. I am pleased to meet you all on this significant day. Your Eminence, Cardinal Peter K. A. Turkson, Prefect of the Dicastery for the Promotion of Integral Human Development, Your Eminence Cardinal Oswald Gracias, Archbishop of Mumbai and President of Catholic Bishops' Conference of India, Your Grace Prakash Mallavarpu, Archbishop of Visakhapatnam, Chairperson of CBCI Office for Health and Ecclesiastical Advisor to CHAI, respected and reverend fathers and sisters, invited dignitaries from various fields of health and allied areas, Ms. Anuvinda Barki, Advocate, Executive Director of Christian Coalition for Health, my colleagues, board members from CHAI and regional units, ex-presidents and ex-director generals of CHAI, dignitaries from CHAI's member institution, Father Matthew Abraham, Director General of CHAI, and my dear CHAI staff, other invitees who are present with us today. First and foremost, it is my delight to welcome you all to the 78th Annual General Body Meeting 2021, which is noteworthy in the history of CHAI. I am privileged to address you all as the President of CHAI, and my joy is overwhelming as we complete 77 years of successful health ministry for our country with a vision to reach health for all, and having 78th General Body Meeting right now focusing on the theme Resilience, Compassion, and Quality Care during COVID-19. On this occasion, in a special way, I remember Sister Dr. Mary Glowry and her colleagues who have paved the ways for establishing CHAI, and pray that they intercede from heaven to us to have a successful deliberations on this 78th Annual General Body Meeting. Also, with gratitude, I remember all the previous directors, presidents, CHAI board members, regional board members, and previous CHAI staff who had worked relentlessly to make CHAI as it is today. COVID pandemic came unexpected. For nearly 2 years now, the whole world has been struggling to deal with it, and so we in India. Now, vaccines have come as a big relief, and yet people speak of a third wave. CHAI, in the very first COVID wave itself, proactively involved in relief services in spite of all hurdles, reaching to people with food kits, personal protective equipments, and emergency medicine. And in the second wave, in a greater scale, supplying medical equipments, personal protective equipments, and machines to the member institutions. The success of CHAI is always with its member institutions. The unity and commitment you show, the hard work you put in, the collaboration you extend are the ways for success of CHAI, and I thank sincerely every member for your generous and noble contributions. Pandemic continues to remind us that we pursue lending a helping hand. We all need to be united and support one another. Cardinal Peter Turkson spoke recently through Vatican News on the need for reaching out to people during pandemic. He said, to anyone who is affected by COVID, there is a need to reach out with a hand to support, to help, and to lift up anybody. He also said, for those who have lost their loved ones, there is also the need for the hand of consolation and solace to help them in their sorrow. With these few words aside on the pandemic, may I turn to welcome every one of you. His Eminence Cardinal Peter Turkson, the chief guest of the inaugural ceremony today. His Eminence is not able to join us now because of his previous commitments. We have his pre-recorded voice for the inaugural ceremony. I cordially welcome you, Eminence Cardinal Peter Turkson, to this AGBM. Your Eminence Cardinal Oswald Gracious, Archbishop of Mumbai and President of Catholic Bishops Conference of India. Your Eminence, we have received your message as you wouldn't be able to join us for the meeting today. I warmly welcome and my heartfelt greetings to your Eminence. Your Grace, Prakash Mallavarpu, Archbishop of Visakhapatnam, Chairperson of CBCI Office for Health and Ecclesiastical Advisor of CHAI. You have been a strong pillar for CHAI, supporting, guiding, advising, and mediating in the past and present. Your Grace, I welcome you cordially to this AGBM today. We have with us dignitaries representing partner organizations and institutions. Sister Jane Wakafu, Associate Vice President of Program Operations and Head of Catholic Sisters, Conrad Hilton Foundation. Ms. Bridget Mondi-Lotz, Program Officer, India Desk Misarior. Sister Carol Keehan, DC, Lead India Health Task of the Vatican COVID-19 Commission. Ms. Maria Mayer, Australian philanthropist, Dr. Priya John, General Secretary, Christian Medical Association of India, Mr. Sendil Kumar, Executive Director, Catholic Relief Services, Ms. Margaret Kurian, Coordinator for Administrative Training, Emmanuel Hospital Association, Sister Dr. Beena, UMI, President of Sister Doctors Forum of India, Dr. J.V. Peter, Director of Christian Medical College, Vellore, Dr. John Tekakara, Associate Director of St. John's National Academy of Health Sciences, Father Julius Harakkal, Secretary CBCI Health Commission, New Delhi, and First Vice President of CHOI, Father Joe Mannath, National Secretary of Conference of Religious of India, Father Paul Munjali, Executive Director, Caritas India, Sister Sarala Makwan, National President of Catholic Nurses Guild of India. It's my honor to extend my lovely and warm welcome to you all in the name of CHOI. Thank you for joining us today in spite of all your other commitments. I cheerfully welcome to this AGBM all our CHOI board members, my colleagues, and regional board members. I am proud to say in this assembly that you are the backbone of CHOI. Today, we have with us CHOI's ex-presidents, Sister Dr. Vijay Sharma, Sister Cletus Daisy JMG, Father Julius Harakkal, Sister Dina SCN, and also CHOI's ex-Director Generals, Most Reverend Bishop Peter Remigius and Father Sebastian Ause Parambil. I extend my joyful welcome to you all to this AGBM and appreciate for joining with us. Dear beloved Father John Vatamatam, though you are not present here, we fondly remember you on this occasion for your self-sacrificing services to CHOI as Executive Director for 15 years. Dear Ms. Anvinda Woki, Advocate, Executive Director of Christian Coalition for Health, I am indeed glad to welcome you to this AGBM and heartfully thank you for accepting as the MC of this great event. I do admire your special interest and involvement, your guidance and support in the excellence of CHOI. There is something very special to mention about Father Dr. Matthew Abraham, Director General of CHOI, and CHOI staff members. You are the elite of CHOI and you are the ones who have worked hard to make this meeting a reality. I cheerfully welcome you all. Last but not the least, dear CHOI members and CHOI member institutions, CHOI is greatly proud of you, dear sisters and fathers, for the commitment and dedication you show towards CHOI. You are the essence and aroma of CHOI. As the president of CHOI, I affectionately welcome each and every one of you and wish you all a fruitful and successful participation in this AGBM today. Dear friends, I do say sorry if I have not pronounced your names correctly. If I have failed to mention anyone, once again, I sincerely welcome you all for this 78th AGBM 2021 on this blessed day. Jai Jesus, Jai Hind.
Thank you, Sister Victoria, for the warm welcome. At this point of time, I would like to recognize Father Josh Strum. He is who is based at the Vatican. He has been present here today and has been instrumental for coordinating and helping us get Cardinal Turkson, our chief guest today, his video speech. May we get a glimpse of Father Josh, if he's present?
I am President Adivintha, and thank you and congratulations for the great meeting we have had today. And also I would take the occasion to thank Father Matthew and the entire CHAI for the great collaboration with our dicastery. And if I might say, also in the realization of the Laudato Si Action platform. We very much appreciate your leadership, all that you do. And Cardinal Turkson's message and my own physical, virtual presence at the meeting is a symbol, is a sign of our appreciation and of our willingness to carry on journeying together. Thank you very much and count on us.
Thank you, Father Josh, for being present here today.
Thank you. Thank you.
Cardinal Peter K. A. Turkson is the prefect of the dicastery for the promotion of integral human development. Appointed as a cardinal by His Holiness Pope John Paul II in 2003, he has served as Archbishop of Cape Coast. He was the president of the Pontifical Council for Justice and Peace. Cardinal Turkson is a member of various organizations. He was appointed as a member of the Congregation for Catholic Education. Cardinal Peter Turkson has sent a video recording of his address to the CHAI AGBM.
Your Excellencies, my Lord Archbishop and Bishops, dear Reverend Fathers, and all of you, dear sisters, brothers and sisters, members of the Catholic Health Association of India, we bring you very warm greetings from the Dicastery for Promoting Integral Human Development on this beautiful Friday morning, at least here in Rome, and wish your meeting these few days great success. As you know, the Catholic Health Association of India is a fulfillment, a realization in its own way of the great parable told in the gospel about the mustard seed. A very simple, lowly gesture of Sister Mary Glory is become this huge, stupendous, admirable tree of the Catholic Health Association of India that reaches out with its huge membership of over 3,000 institutions and structures, the health needs of the subcontinent in the world of India. We commend all of you very highly and commend every initiative of yours and everything that you're doing to God for His protection, for His guidance and care. We recognize that you are pursuing and realizing the vision of Sister Mary Glory, of the Congregation of Jesus, Mary, and Joseph, and that now it's been possible to do this in partnership with the University of Melbourne and other such institutions. We thank them all for coming to your assistance and enable you to fulfill and to carry out the vision of Sister Mary. We praise God for your institution, for everything that you've been able to do. The past 2 years, as we all know, we've lived through very challenging times. The COVID-19 pandemic has been challenging to all health institutions around the world, and particularly yours also in India. And we thank and we commend you for the way you've been able to rise up to the occasion to bring the great and necessary health needs of people who were afflicted and who suffered from this pandemic. Again, as you know, here in the Vatican, already last year in March, Pope Francis asked us to create a small commission to follow the issue of the pandemic and help local churches deal with it. So you may already know, or you may have read from our website, that we did not only send out directives to local churches about how to deal with the issue, but we created 4 task forces here which maintain contact with local churches, and to date we've spoken to about 82 of them. We also created a structure that also studied and continues to do research on the impact of the pandemic on a lot of social structures, particularly the area of jobs, economics, finance, access to healthcare, and security issues. Then we continue also to making use of one of these working groups, task forces, to engage in great advocacy around the world for equal and inclusive access to the vaccine, for the cancellation or suspension of debt, so poor indebted countries can use the finances, the monies to take care of their sick, and then even to do advocacy for the suspension of intellectual property rights, so that countries which have distinct labs like here in India can undertake to produce local vaccines for the use of its own population. So these are very humble, modest gestures that we've done over here, all with view to supporting what local churches are able to do, and so your own efforts on the level of child. As you know, in carrying out the vision of Sister Mary Glowley, you have sought to do what Jesus entrusted and charged his disciples to do. You represent the realization of the mandate to go out to preach the gospel, but also to heal and to touch the frailty and the vulnerable bodies of people. In so doing, you continue and extend the works of mercy of the Lord himself. And for that, we continue to pray and to commend that your own ministry becomes a very eloquent, credible, and faithful representation of the ministry of Jesus himself. Additionally, in your simple, modest gestures, reaching out to, whether in your research hospitals, in your clinics, or even the poor outlying health facilities that you provide in India, you still continue to present, as it were, a people-sensitive and people-centered approach, not failing to touch the frail, wounded bodies of people and bringing them the relief of health care. We thank and we commend you again for that. And in so doing, as it were, you continue to be the inn, as it were, the inn in the parable of the Good Samaritan. Your health service outlets and clinics and facilities, health hospital facilities, become our modern day inn in which the Good Samaritan brings the needy, the sick to be taken care of. And there, what happens in the inn, you spend time, you spend resources to bring relief and healing to the poor. And finally, in so doing, you also do the great gesture and do the great work of realizing on earth what the Lord came to do, to touch our human weakness and our human frailty, not refraining to touch with the warmth of your hand, the warmth of your own presence, their ailing, sick, frail bodies who lie victims of disease and sickness. We thank you for all of this, and by way of concluding, wish to recall that before the health services that you render, there are only two possible enemies, which we can represent as two P's. The only obstacles to what you do and the obstacles to the success of your ministry is policy, the policy of government, the policy of industry, the policy of different businesses, which may, as it were, hinder access to health care. So policy formulation on the part of authorities can become sometimes obstacle to inclusive and equal access to health care. And the other obstacle is poverty. Poverty is the only other obstacle that can come between your administration of health care and people's access and ability to make use of them. So these two P's then are the things to look out for. With government and its policy, we can enter into dialogue and negotiate. With poverty, we can also bring ourselves down to a level and not make poverty become an obstacle to anybody's access to your healthcare services. So my dear friends, members of Catholic Health Association of India, congratulations again on your celebration of this great day. And may Sister Mary Glory, whose cause for canonization you've taken up, enjoy the great spirit of God's grace, and may the Lord strengthen and support all of you in what you do, and may God bless you now and forever. Amen. Thank you for your event.
Father Josh, we would request you to kindly thank Cardinal Turkson for this wonderful message that he has sent us. He has rightly elucidated the two obstacles of government policy and poverty, and both of which can be overcome. And with help from your dicastery and all of you at your place of work and in Vatican, I'm sure we will be able to overcome these two obstacles. Thank you very much for bringing us this message.
Certainly, Arvind, I know also personally how much Cardinal Turkson holds the Chai in great esteem. So I can really vouch for it. Yeah, definitely. Thank you.
Thank you very much. Cardinal Oswald Gracious is the president of the Catholic Bishops' Conference of India and the Archbishop of Bombay. He is a member of the Congregation of Catholic Education and Pontifical Council for Legislative Texts. A very learned person, His Eminence was conferred his doctorate in canon law from the Pontifical Urbania University. He has been granted the title Lawyer of the Roman Rota by Pope Francis. Unfortunately, His Eminence is otherwise engaged today and is unable to be present with us today. His Eminence has sent us a video recording of his inaugural address.
My dear Father Matthew and members of the Catholic Health Association of India, I'm very happy to greet you as you are having your 78th annual General Body Meeting. I have in the past attended some of your meetings. I remember I came to Hyderabad once for that, and I've had much contact with Chai, and I was keen on attending this General Body Meeting because of the context in which we are working and living, the pandemic and the relief work that you've done. I went to Delhi to meet the Caritas governing body just to thank them, and I wanted to be here just to thank you. But unfortunately, I have a meeting of South American bishops in Mexico, Salem, and because of that, it makes it impossible for me to be with you even on the day itself. I want to congratulate and really sincerely congratulate and thank Chai for all you're doing. You are a network of 3,500 associations, institutions for health, and I have no doubt it's after the government, it's one of the biggest networks. I can't think of any other network which would have such an outreach, such a spread. You are aware that immediately after the pandemic, when the lockdown was announced, I wrote to the Prime Minister offering the services of the Church in the relief efforts. And the Prime Minister's office replied to me immediately saying that they welcome it and can we have a meeting to discuss our role. And that was immediately the very next day. And then they fixed a meeting and I asked me to send my representatives or come myself. I thought that better I send people who know about it, and I requested Father Matthew. I said Chai does the medical work and Caritas the relief work, Father Munjali the director, and the two of them went for the meeting. Matthew, you went for the meeting, and I think it was a helpful meeting, and I remember rightly, the Prime Minister himself was present for the meeting. And ever since then, you have not looked back. You worked so hard. Caritas has done tremendous work in relief work, especially in the migrant crisis when they were going home. But you've done tremendous work in the health field and a coordinated effort, really. This was really a big health crisis, and CHAI has gotten really in a very effective manner, in a generous manner. You have helped in getting medicines, procuring medicines, helped in getting protective equipment, in getting oxygen concentrators, getting oxygen plants, etc., coordinating efforts, making sure medicine is available. I remember a couple of times Father Matthew got in touch with me at the very beginning, saying there were some little difficulties at the local level. I tried to smooth it out. I got in touch with Delhi, and then they told me whom to approach. We tried. I hope it was some relief, but those things always happen. Keep up your good work, I want to say. You've got a general body meeting, you'll discuss, you'll share successes, challenges, mistakes we all make, and try to improve. But I think that this COVID has really also given new energy, new life because of the new challenges that you've faced. Continue your good work. Continue your collaboration. Don't get discouraged. All of us, including me, are very relaxed a bit, but also a little apprehensive. Will the third wave strike us? And everybody, our own experts in India from Delhi, ICMR, also in the United States, Dr. Fauci have been saying, don't think it's over as yet. Don't let your guard down. That's the biggest danger. We made that mistake after the first wave, and so we were hit even more badly. In the Archdiocese of Bombay, I'm trying to see how we could prepare ourselves to some extent for the third wave. I suggest that you do the same also. Prepare yourself. If it comes, I hope it doesn't come. If it doesn't come, anything you organize or arrange will never go waste. So, Father Matthew, you have thank you on behalf of everybody. I'm going to say thank you to you and to all the members of CHAI, to all the doctors, the numerous sisters, particularly in the rural areas, who have got such limited facilities, and transport is difficult, electricity is not regular, oxygen is a shortage, medicines are not easily available. I know the challenges you have, but you've gone on bravely. Keep it up. You've been the compassionate face of Jesus to all these people. Keep up your good work. Have a successful meeting, and we'll pray for each other. I'll keep you in my prayers as you have your meeting, and we'll see each other and keep up, and we'll be in touch with each other. Collaborate. I suggest also collaborate with Caritas, keep in touch with Caritas so that we can work together, the church can work together. God bless you.
Good morning, and thank you, Father Matthew and CHAI members. I am delighted to be with you today as you celebrate the 78th Annual General Body Meeting with a profound theme: resilience, compassionate, and quality care during COVID-19. What an incredible way to stay connected, reflect, and strengthen each other and CHAI's community of practice. I bring greetings from the Conrad N. Hilton Foundation and the Catholic Sisters team, and assure you of our continued prayers and partnership in strengthening the vitality of CHAI and in supporting Catholic sisters in India through formation, education, and support services to continue improving the lives of children, youth, and families living in conditions of disadvantage. As I reflect on the past 20 months, the cloud of pandemic covers and continues to threaten life and livelihood globally. The words in Trevor Psalms Thompson's hymn have anchored and lifted my spirit during these days. We belong to you, Lord of our longing. We belong to you. In our daily living, dying, and rising, we belong to you. Indeed, even in this challenging time, the love and tenderness of our Creator God, to whom we belong, continues to accompany, sustain, and strengthen us. Yes, we all belong to God. Today's themes offers an opportunity to reflect on the fidelity of God's love despite a wilderness of pain, isolation, and struggle caused by the pandemic. Seemingly, the pandemic has not spared continental nations, nor distinguished between social standing, culture, wealth, or religion. Rich or poor alike are significantly impacted. Over the past year and a half, we have listened to painfully stories of horror, people dying without saying goodbyes to their loved ones, families in difficulties going hungry, loss of livelihood, psychological breakdown due to stress, and escalating healthcare bills consuming family savings. The pandemic has deeply impacted India with over 34 million confirmed COVID-19 cases and over 462,000 deaths. Behind these numbers are families and communities experiencing the loss of loved ones. I have often wondered, how do we give hope to individuals, families, and communities severely impacted by this pandemic? And how do we accompany and show compassion to the overwhelmed healthcare workers and people whose lives have been altered permanently because of loss of their loved ones? The impact of the pandemic on healthcare system and staff, including long working hours, personal stress, limited or lack of COVID therapies, and death of loved ones, has untold repercussions. For those working in child networks, I can only imagine the experiences of fatigue of healthcare staff. Thank you for your resilience, showing up each day and compassionately delivering life-giving services to all. I marvel and recognize with gratitude your resilience, your commitment, hard work, and the spirit of compassion you have continued to demonstrate during these challenging times. Through your life and actions, you have been the embodiment of Catholic social teaching principles on the preferential option for the poor and the gospel value. Love your neighbor as yourself. You have risked your own lives to bring healing and wholeness to those suffering from the pandemic. As I reflect on the impact of COVID-19 and the role of Hilton Foundation and CHAI, I think of our founder, Conrad Hilton, a man filled with faith and desire to make a difference in the world by bestowing his cumulative wealth from Hilton hotels to improving the lives of individuals living in poverty and experiencing disadvantage throughout the world. We at the foundation recognize the impact of pandemic on families and communities and institutions like those of CHAI. Studies show that lockdowns have caused an increase in criminal operations, human trafficking, teenage pregnancy, domestic violence, and many untold sufferings. And a World Bank report shows extreme poverty has increased exponentially in 2020 for the first time over 20 years, and is expected to have additional 150 million people live in poverty by the end of 2021. There are many pains, but there are so many lessons from the pandemic, and the negative ones are obvious. However, the lockdowns could also provide some spiritual perspective, an invitation to stop, to pause, become aware of our surrounding, observe, listen, and reflect, and even go deeper in the recesses of our hearts to reconnect with God, to reveal to us the appropriate actions we need to take moving forward. Regardless of the challenges, the pandemic has taught us that we must not work alone. We must be networked together because our collective knowledge, collective experience, and collective support produce a collective impact. We serve best when we serve together. This 78th annual General Body Meeting demonstrates the importance of collaboration and partnership for transformation of child networks and communities. The pandemic has transformed our way of doing business and interacting with each other, and technology has allowed us to connect virtually and continue our work in ways we could not have imagined. Personally, I have drawn strength, harmony, and peace in turning to the prophet Isaiah, who says, "Behold, I am doing a new thing. Now it springs forth. Do you not perceive it? I will make a way in the wilderness and rivers in the desert." I hope we can all recognize God is working in us and evaluate and adapt new ways of connecting and working for social, spiritual, health, and economic transformation. I would like to turn to how we have planned to support Chai and Catholic sisters in India. We have articulated a 5-year strategy that includes supporting Catholic sisters' access to resources for formation, education, elderly care, and well-being of sisters, supporting sisters' human development to work in partnership with others and career pathways, supporting partnerships and collaborative networks for innovation and scaling solutions, and supporting in building data management platforms, research and evaluation practices. We hope to continue collaborating with Chai to participate in this strategic plan. Throughout the ongoing pandemic, the Foundation has provided grants to support organizations providing COVID-19 related services to vulnerable communities around the world. Last year, at the height of the pandemic, we partnered with Chai through a grant to quickly respond in mitigating spread of COVID-19 and provide resources to communities and healthcare units that needed immediate support. We've supported Sisters Ambassadors program to advocate for equitable vaccine distribution. And next week, a grant in the amount of 1.2 million will be made to Chai to support in reigniting ministries of sisters impacted by COVID-19 across India and support rural healthcare facilities and families experiencing difficulties during these challenging times. In the face of despair, we are called to determine the most effective, sustainable, and compassionate strategies to respond to this crisis and replicate positive outcomes. A specific example of challenge experienced in many countries, including India, is on ministering to those people who remain resistant to vaccination against COVID-19. The Sisters Ambassadors program, for example, is a collaborative strategy whose purpose is to educate and provide resources and also provide equitable vaccine distribution. In this regard, I would advise, and I turn to the book of Numbers 21, because it offers insight into how vulnerability and the collective action for a cure. After leaving Egypt, the Israelites were on their way to the promised land, and the going got tough. They grumbled and complained against God, and then the going got even tougher. As a result, many Israelites died after being bitten by fiery serpents. Then the Lord said to Moses, "Make a snake and put it up on a pole. Anyone who is bitten can look at it and live." God intervened and Israelites lived. Sometimes vulnerability is necessary to help us rely on God for healing, comfort, courage, strength, and love. Could the vaccine serve as a serpent to help end the pandemic? Pope Francis encourages, a vaccine is an act of love. Now, I turn to collaborative networks for the vitality of religious life and organizations such as Chai, demonstrating true communion in mission, transcend boundaries and navigate cultural, ethnic, regional, and political differences. The pandemic has taught us that we are all vulnerable and fragile. And St. Paul points us in the direction we need to take to move, and values that we need to embody. And he says, and these three will remain: faith, hope, and love. And the greatest of this is love. We have seen an overflow of love and hope in the darkest hours of this pandemic. Brothers and sisters, let us continue to join together with CHAI. Let us join in love and faith to one another. Let us not act alone, but in harmony and unanimity. And we promise our continued support to make a difference to the most vulnerable in our society. I would like to end with an encouragement from our founder. He says, love one another, for that is the whole law. The peoples of the world deserve to be loved and encouraged, never to be abandoned, to wander alone in poverty and darkness. Congratulations to CHAI, and may God bless CHAI and sustain all members today and always. May God bless you. Thank you.
Thank you, Sister Jane, for addressing the gathering today. The work of Conrad N. Hilton Foundation has supported us in India, and our sisters at CHAI have benefited greatly. Thank you once again.
Okay.
Sister Carol Keehan is presently the co-chair of the Health Task Force of the Vatican COVID Commission. She served as president and CEO of the Catholic Health Association of the United States from 2005 to 2019. She's a member of the Congregation of the Daughters of Charity of St. Vincent de Paul. Pope Benedict XVI awarded Sister Carol with the Cross of the Church and Pontiff for her dedication to carrying on the healing ministry of Jesus Christ. She is a member of the Board of Trustees of Georgetown University. I now call upon Sister Carol Keehan to address the CHAI members gathered here today.
Thank you very, very much. And I want to say that this is my second time being able to talk with the members of CHAI. And the last time it was in person, and it was just an incredible experience. I came away so impressed with the quality of the work and the enormous collegiality of the members. And so it's a joy to be back with you. And it's a joy to work with Father Matthew in trying to collaborate in ways to strengthen what CHAI can do for the people of India, particularly in this pandemic. And I would want to say immediately that without Sister Jane and the work and the support of the Hilton Foundation, we would not be able to do hardly anything. Sister Jane's quick, fast movement to say, we can help with this, we can help with that. Let's get together. Let's talk about making the visions of the Pope's COVID healthcare task force a reality now, not waiting and waiting, made all the difference in the world. And so I publicly want to thank her on your behalf and on behalf of many other countries. Sister Jane showed you all the work and the statistics that are out there, so I'm not going to repeat them. We all know that India was hit with like a ton of bricks with that second wave of the COVID disease. And we were heartbroken as we watched the death rates, as we watched the challenges for your healthcare facilities, your healthcare workers, and the people of India. And we were heartbroken in India, as in so many other countries, to have people so reluctant to take the vaccine, who have so much misinformation about the vaccine. And India has a special gift to bring to the sick and to the very poor, especially because of your network of hospitals, of sister nurses and sister doctors and sister social workers, and the fact that you have focused so much on the very poor and people in rural areas. And I can tell you, one of the top scientists in the world working on the COVID vaccine and on the disease itself said to me when we were talking about this resistance, he said, "Sister, you can bring the smartest scientists in the world in the room, and you can bring the top government official from the country in the room, and people will ignore them." He said, "What people need to hear today is someone who was with them before COVID, will be with them during COVID, and will be with them after COVID. Those are the people they trust." And so we knew that there were a lot of people who were going to try to be speaking, but we knew that the sisters had some of the best potential out there. In fact, I would say the best potential to help make change and also to help deliver the vaccines given their network. Like Cardinal Garcia, I truly hope we don't have a third wave in India, and you've made so much progress. As Sister Jane talked, we had developed this sister ambassador concept because that's where we could get on the ground fastest and most effectively. And I just got last week the first full report of the sister ambassadors programs in 14 states in India. I couldn't stop cheering you on when I read those reports. What has been done, and I looked at the pictures, and it is so clear that you went after the people who need you the most and the people who would be most reluctant and wouldn't listen. And you made tremendous progress. And there's still so much more progress to make. But the fact that we have been able to find a way to break down some of that resistance in a significant way is just so important. And it is exactly what Pope Francis wanted from his COVID commission. Pope Francis, when he was beginning to write his encyclical Fratelli Tutti, said, if we think that the goal with this COVID disease is to get back to the situation we were in pre-COVID, that is absolutely wrong. We were not we were not treating our brothers and sisters fairly, with dignity. And as his main theme in Fratelli Tutti, he goes into a great deal of depth on the parable of the Good Samaritan. The Good Samaritan, and he points out what it was to answer Jesus' question of what does it mean to be neighbor? To be neighbor. And he talks about the tremendous difference between the priest and the Levite and the Samaritan, who was not of this person's nation, language, cult, religion. And this is the person who was neighbor. And the Pope talks about the goal has got to be in each of our lives and in our world today, because we know the enormity of the depravity in our world today and the cruelty in our world today. And as Sister Jane points out, this pandemic has created the groundwork for much more in trafficking, whether sexual trafficking, slavery, abuse of other people. And so the Holy Father talks about enlarging our network of people that we consider our neighbor, and that those people don't look like us, are not our same religion, are not our same color, are not our same orientation, but they are our neighbor. They are created in the image and likeness of God. And the Holy Father knows that, and he set up the COVID Commission with 4 task forces. One is on the economy, because we know how disproportionate the economy is in many, many countries today, and how disproportionate it is country to country. The security task force, because we know how many people are simply not even secure in their own homes in many countries. And the ecology task force, because we must protect our world. And lastly, the health task force. Health will be the one most aggressive at this moment, but then we must be just as aggressive with the other 3 task forces. I am so grateful to everyone at CHAI, and so especially grateful to all of those sister ambassadors, because they have really made a tremendous dent. And they are showing what it means to enlarge the circle of people we feel called to be neighbor to. And if we send no other message to our world today, country by country, that would be the most important message we could send. And I just want to say to all of you, thank you, thank you, thank you. May God bless you. May God give you strength to continue on. You are doing enormous good work, and you are really helping the people of India. And we are so honored that we could be a part of that. And I know that when Holy Father sees the reports that I just read last week, he will be cheering you on and clapping like crazy, because you're doing just what he wanted people to do. You're reaching out. And so I say to you, God bless you. Thank you for letting me work a little bit with you. Thank you again to Sister Jane for making this so possible so quickly. And may we all continue to work together to make our world a much, much better world in the likeness that God wants it to be. Thank you.
Thank you, Sister Carol, for your acknowledgement of the work of the sisters of India and CHAI members gathered here today. Thank you once again for your inspiring message.
Thank you.
Our next speaker is no stranger to us. His Grace, Bishop Prakash Mallavarapu, is the Archbishop of Visakhapatnam and chairperson of the Catholic Bishops' Conference of India Office for Healthcare. He provides immense support to us as the ecclesiastical advisor to CHAI. His Grace has a master's in theology and a doctorate in Indian philosophy. He was ordained as a bishop of Kadapa Diocese in 1998, and in 2012, he took charge of the Archdiocese of Visakhapatnam. Bishop Prakash has held the position of Secretary General CBCI. I now call upon Bishop Prakash Mallavarapu to address you today.
Good morning to everybody. Can you hear me?
Yes, Bishop, we can hear you.
Yeah, I just arrived from Kerala after meeting our regional secretaries of different regions across the country. So I'm in a hurry. So maybe I'm glad how I should have been better prepared. That's why I took time to join you. Now, let me first say good morning to all of you, the participants in this AGBM, and more especially Sister Victoria, the President of CHAI, and Director for Matthew, and all the board members, and also all the regional secretaries, and all the special invitees that have come to join this online CHAI meeting today. Once again, we are here for this AGBM. It is a gathering in the name of the Divine Healer and in the name of and on behalf of our people who are with us in our healing ministry. It is a gathering, I believe, on behalf of all the sick and the suffering who look towards us and our establishments for healing and relief. Therefore, for all these reasons, it is a joyful gathering too. This annual gathering, event, beyond being a formality, and will certainly renew and strengthen the bond between us and be a source of encouragement and enthusiasm to go further in this our ministry of healing in the name of that divine healer, our Lord Jesus Christ. I'm glad that I am able to attend this AGBM and be with all of you on this occasion. As suggested, that our sharing and reflections are centered on the theme resilience, compassionate and quality care during COVID-19. It is, I suppose, I believe, a joyful recalling of what God in His providence has accomplished for the suffering people through through the network of healthcare providers, namely the CHAI members, with a whole range of things that we experienced, good and bad, during the first wave of the COVID-19. Our God prepared us to plunge into action with a little more confidence and preparedness. This is not because we had all the answers to the multiple challenges and questions the second wave has suddenly placed before us. Our confidence is from the God who always would multiply the 5 loaves and 2 fish and provide us enough to start with and keep multiplying whatever way that we need and our people need. And I suppose our experience in this second wave of COVID-19, our involvement and our interventions were fruitful, not say successful, fruitful and effective because of this God of providence who has been with us. I noticed that there was an overall prevalence of enthusiasm and readiness from various quarters, from the members of CHAI who want to be effectively at the service of people and their families affected by COVID-19 second wave. The 2.5 months of the widespread pandemic with so many succumbing to death and devastating effects on the families and friends, CHAI and its members were able to reach out to the victims, opening the hospital doors and generous hearts. Our contribution is appreciated by different sections of the society from across the country, including the local and the state civil authorities and the national government as well. that our services have been credible and timely. We could not prevent or take care of everything that this pandemic second wave has brought, but we were there standing with and for the people facing this frightful second wave. We were there with love and compassion and confidence to do the best that is possible in our hands. Now, at this moment, I want to recall along with you all the generous people that have been with us, with you, both financially, technically, and also their word of mouth that with which they have been encouraging us and encouraging you to be there, involved, and at the service of the people and families and those who are affected by COVID-19. I want to, with appreciation and gratitude towards all those people and institutions and associations who have been with you and with us in this very challenging time of COVID-19 second wave. Now, what have we to say about the future interventions in such challenging and demanding situation that might still come up in different areas of health concerns? Do not work, I would say, let us not work in isolation, but together. There are many people of goodwill, as we have experienced, and there are many generous institutions and associations who will definitely extend their support and assistance in these challenging situations. We cannot do everything we know, but with what God provides through others, we can be confident that we can do and help people in the difficult situations. It is the non-institutional way that we can reach out and extend help to individual patients and their families at the grassroots level in many tangible ways. This has been, I'm sure, this time from what I heard and what I witnessed, is the experience of most of you in the field in this COVID-19. At the grassroots level, there are so many helping hands in different ways that have come forward to chip in their share of contribution, both financially, as human resource, and also standing by us to encourage us to be there effectively. And that is where I think one of the lessons we can learn, that at the institutional level and clinical treatment at the hospital level, we had serious and rather very serious limitations. But when we had on the grassroots level, local people, local civil authorities, and people of goodwill, when they were with us and their support, I'm sure that is the experience of all of you. We have been able to do things, and we have to build on this. How locally, beyond our establishment level, beyond our clinical level, how we can be there along with other people, reaching out concretely, people, families, individuals, and the effects of this pandemic on families and other people and the whole set of people connected to that. Institutional help has many limitations, we know, but locally organized innovative ways of dealing with the situation and taking the help of everyone or anyone that is ready has been more effective and fruitful. I think let us feel proud of what we could do in this very challenging time of COVID-19 second wave. Let us also take stock of all the little and big lessons we have learned and experiences we were blessed with during this pandemic time. I join you, members of CHAI, today and always to thank the Almighty and thank all those who stood by you in different capacities. Let us continue the good work on behalf of CBCI and more especially on behalf of the CBCI Office for Healthcare I extend my appreciation to Chai and all the members of Chai and the witness that you have given and the compassionate love of the divine healer that you have extended and shared with so many hundreds and thousands of people who are affected by this COVID-19. May we look forward with hope, may we look forward with enthusiasm, trusting the divine providence and putting together our resources, human and other resources, and be effectively there, confidently be there to witness the compassionate love and mercy of our divine healer. The rest he will accomplish the way he wants to accomplish through us in the coming days as well. May the deliberations today, I wish all the Chai members attending this meeting strengthen each other. And this is my prayer, this is my wish for all of you and for the organizers, especially the central team at the Chai office, the director for Matthew, Sister Victoria, the president, and all those who have contributed towards organizing this event today. Thank you. God bless us all.
Thank you, Bishop, for your encouraging words and for advising us to take stock of what we have learned over the past year and during this pandemic. We also thank you for reminding us that this is a joyful time to come together and support one another. Thank you very much. Ms. Maria Mayes is the Deputy Chairperson of the Board of the State Library of Victoria in Australia. A person with varied interest, she is involved in the research, protection, and promotion of Kimberley rock art. She is on the board of St. Mary's College at the University of Melbourne and a member of the Brunette Institute. Ms. Mayes is also a member of the board of the Museum of Australian Democracy and International Conservation. She and her husband have visited Chai and have been generous in their support to Chai, especially during the pandemic. We ask you now to come forward and address the gathering, Ms. Mayes.
Thank you very much. Thank you for inviting me. I feel privileged to speak at the inaugural ceremony of the 78th Annual General Body Meeting of Chai. To Father Matthew and all the members of Chai, I'm speaking from Victoria in Australia, and I come with such a different perspective on things. I have enjoyed so much listening to the 5 speakers before me, and I come with a completely different perspective. I am looking at the figures now as I sit here of the differences between Australia and India. You've had 34.5 million cases and 464,000 deaths. Here in Australia, we've had 193,000 cases and 1,900 deaths. So it's a different world. And as you know, we're a resource-rich country. So when I give you my Melbourne perspective on the pandemic, I'm conscious of how very, very different the circumstances are. Your themes for this meeting of resilience, compassion, and quality care are relevant in relation to COVID-19 around the world, and they do resonate in Australia. In Melbourne, in Victoria, where I live, we've had more lockdown days than anywhere else on the globe.
Now reduce the volume.
Sorry?
Please go ahead. Somebody's mic is on.
No, sorry. Go ahead.
We've had 263 days of lockdown, and thoughts of resilience, compassion, and quality care have highlight many of the issues that have emerged for us. India, like Australia, has had its lockdowns, and the dislocation and disruption and distress caused by them has been much greater than here. But let me tell you a little about what it's been like here. The lockdowns were severe and they were enforced with sometimes what looked like oppressive force. Schooling was disrupted for long periods of time, and while classes were conducted online, no one is prepared to say that children have not suffered enduring disadvantage from the prolonged lockdowns. Many businesses were forced to close and have remained closed. Others, where people could work from home, continued and have resumed normal business again, but on a lesser scale. Many workers were just put out of work and many have not found work again. Huge amounts of money to support businesses forced to close and to support their employees was provided by government, but many didn't qualify for it. During the curfew, during the lockdown, there was a curfew of 9 p.m. and people were only allowed to leave home for the 4 reasons. And I think this was worldwide: work or education, if unable to do it from home, care or caregiving, exercise that was limited to 1 hour and within a couple of kilometres of people's homes, and to buy food and to attend essential medical services. Families with their aged family members in homes were prevented from visiting or even from providing care when the nursing home staff were unable to cope. One nursing home is an awful example of what can happen when compassion and quality care become casualties. There was a home, it's known as St. Basil's, an aged care facility providing for members of the Greek Orthodox community. It had 117 residents and 120 staff at the start of the outbreak. 45 of the residents died, and another 145 of the combined staff and residents contracted the virus. There's at present an inquiry going on into what happened at St. Basil's, and what it's coming out, it's a tragic story of bureaucratic bungling. And as I say, the first casualties were compassion and quality care. I was in the fortunate position to be able to retreat to the country where the restrictions were not so severe, but it meant family life was disrupted. And for the granddaughter who stayed with me, away from her mother and brother, and did her schooling online with me, the separation from family went on far too long. Life for all was stressful. But something good happened. What happened at a community level in the country, and even more so in the cities, was something quite wonderful. There's a new caring, a new concern for one's neighbour. In fact, the development of a sense of community and of compassion grew. The elderly, those living alone, those with young children, those deprived of income, those who needed support in all sorts of ways, found that neighbours, often but not always those who'd been forced to stay at home, became friends and gave critical support. There are many examples of individuals taking up onerous loads of volunteer work with generosity and enthusiasm. I heard that in India, the number of volunteers wanting to help verged on the overwhelming. And I don't think it got to that point here, but there were many examples of people putting their life energies and their love into helping others. There've been many impacts as a result of COVID, and a full accounting, I think, for all of us is some way off. And as we say, there could well be a third wave, and we're not on the other side of it yet. But in Australia, there's just one particular difference that I'm not sure anyone else, unique to us, I think. We divided along state lines here in Australia. The 5 states implemented their own COVID restrictions, and barriers within the country grew up that have not yet broken down. Western Australia still has not opened its borders to the rest of Australia, and it has left an enduring sense of fragmentation and of a questioning of our once of our sense of self-confidence and our sense of who we are. The harshness with which state boundaries have been enforced have made us, has undermined our sense that we are compassionate, competent and caring people. I believe our self-confidence has taken a blow with the way in this country we've handled it. I'd like to address another matter too, is the matter of philanthropy and COVID in India, and particularly chai. I was in India in the first week of March 2020, when rumblings of what was about to unfold could be heard. I visited Sister Dr. Beena at Holy Family Hospital in Mumbai, and also the sisters at St. Joseph's Hospital at Hoshangabad. I don't think I've got that right, pronounced that properly. Those visits gave me a way of understanding and visualizing what was happening in India as the horrific infection rates soared and the deaths from COVID mounted. I had also on WhatsApp, courtesy of Father Matthew, reports of the selfless service of the missionaries of charity called in to help with nursing in COVID wards, of deaths of treasured and highly skilled sisters like Sister Rani, and Sister Dr. Beena's vivid account of a hospital dealing with COVID that she wrote in July 2020. I wasn't the only one in Australia reading these reports with increasing concern. Australia ranks 8th in the world for philanthropy, with 25% of what's raised going to international causes. Appeals for financial support were run by Entrust Foundation, Friends of CMC Vellore, UNICEF Australia, and from the University of Melbourne came a campaign directed at all its alumni to raise money for India's COVID response. This campaign supported CHAI, Emmanuel Hospital Association and CMC Vellore. At a government level, the development arm of the Department of Trade and Foreign Affairs, DFAT, pledged support to the Indo-Pacific area, concentrating on the supply of vaccines. And in Australia, there is a particular emphasis for us, well, we have a particular responsibility for Timor-Leste and New Guinea. But even so, $37 million was set aside for India over 2020 to 2022, and $27 million of that has already been expended, and principally in vaccine, both supply and availability. Some assistance I know of personally and recommend to others concerned about India. One is the Sister Mary Glowry Scholarships, which last year saw 60 CHAI sisters trained in COVID management with the assistance of Melbourne University. This year in this program, another 67 have been trained. Others are individual instances that have been repeated, I believe, again and again, where a friend, family member or colleague in India who contracted the virus became ill and not able to find a hospital bed or with nothing available, was managed at home and sometimes with phone advice from medical friends in Australia. And I was told about one case of David, whose family was provided with a pulse oximeter and an oxygen concentrator, which ultimately saved his life from funds raised by the friends in Melbourne. The CHAI personnel that I have met in India inspire me and humble me. On a trip in 2019, my husband and I were taken to a range of CHAI projects and programs. We met many of the sisters and the sister doctors. The commitment to resilience, quality care, and compassion, and to working on the margins of society made an indelible impression on us. We saw faith-inspired work driven by the love of Christ that is a reflection of his greatness and goodness. I trust your deliberations today will aid you in your wonderful work. Thank you.
Thank you, Ms. Myers, for appreciating the differences of the experiences between India and Australia during this pandemic, and also for noting the similarities of the loss of jobs, its impact on education and healthcare. And also thank you to Australians for their philanthropy to India, and especially CHAI for its efforts going forward. Thank you very much. I now would like to move on to the next program and section of today's meeting, which is the updates from the Child Directorate. Father Matthew Abraham is the Director General of the Catholic Health Association of India. He is a Redemptorist, priest, and an MBBS from Kottayam Medical College, and MD in Community Medicine from CMC Vellore. He was the Health Secretary of the Catholic Bishops' Conference of India from 2008 to 2015. He has been the chairperson of Technical Resource Group, NACO, Government of India, and the present chairperson of Engage Disability, Link Asia, and the Christian Coalition for Health. He is a member of the Laudato Si Action Platform, steering board, and the lead healthcare working group, Vatican. Father Matthew is passionate about compassionate, affordable, and quality healthcare for all, especially for those people living on the margins of society. I now hand over this session on the updates from CHAI Directorate to Father Matthew.
Father, you're on mute.
Oh, sorry. Yeah, thank you, Anavinda. We'll start with the launch of our annual report, and after that, I'll briefly explain what we have been doing from the CHAI Directorate. Manish. Your Grace, Archbishop Mallavarappu, our ecclesiastical advisor, Sister Victoria, our president, all the speakers and the delegates who are attending our meeting today. A special mention of Sister Jane, Sister Carol, Maria, and also Mark. Even though he's not speaking, Mark is also there, and he's behind. He's also supporting our Sisters Ambassadors program. So happy to see you all today, and we are very glad that you are attending. Last 2 years had been a bit difficult for us. The 2 COVID waves, the FCRA regulations, and the complexity of managing our institutions and also the organizations was quite difficult. Some of the organizations could not survive this stress or distress. Some perished, some survived, some even could bloom or transform some of these challenges into opportunities. I'm proud to say that CHAI is one of those organizations who could negotiate this crisis and transform some of our challenges into opportunities. And I would say that we did reasonably well. Let me share my screen for my presentation. Are you able to see the screen?
Yes, Father.
Thank you. Let me start with a quote from Mother Teresa, Saint Teresa of Calcutta. Charity and love are the same. With charity, you give love. So don't just give money, but reach out your hand instead. This will be the content of my presentation. The response of the COVID response of CHAI, our non-COVID projects, the long-term projects, and something on network strengthening initiatives. Here you will see some numbers and aggregates. But we also know that behind these numbers, there are faces, there are people, children, men, women, those who went through immense suffering, but could also experience the comfort and healing because of our involvement. I don't want to read through these numbers, but you can have a look at it. This is a response from CHAI Directorate with supporting with PPE kits, oxygen concentrators, oxygen cylinders. And we also conducted a lot of webinars, and you can see the number of institutions we could reach through this support. We were able to provide 911 oxygen concentrators, another 200 is on the way, and 437 oxygen cylinders in this process. We were involved in COVID-19 awareness. 61 of our member institutions were actively involved. We also felt that we need to take care of the caregivers. So we have a pilot project with 100 sister doctors on self-care module or self-care initiative. Overall, we could raise about 100 million Indian rupees and about in cash and about 50 million Indian rupees in kind. Of course, these are reasonably good amounts compared to the size of our organization, but compared to the need of the network, this is not a great amount because our network is a huge network. But this help itself is a great help for us, and we appreciate all those who supported us. Along with this, we also did a survey among the members. We know that there are about 300 hospitals which are above 50 beds, and we have about 600 hospitals ranging from 10 beds to 1,000 beds. So this survey was mostly responded by the smaller institutions, and 144 member institutions responded to this survey. Some of the bigger hospitals could not respond. So you know that this is only a tip of the iceberg what I'm presenting, these numbers. So from this response, we know that 72% of our institutions were supported through CHAI. That means there were also others coming in and supporting in our work. We reached about 3.45 lakh people with awareness and COVID relief services. We cared for 76,000 people, providing treatment. Of course, this does not represent the whole number, but this is only a percentage from the survey. 7,800 people were cared in the ICUs. 1.58 lakh people received first dose of COVID vaccine, and 8,000 received both the doses. The numbers, this is an underestimate, numbers will be even much more. The number of staff involved in COVID care, more than 4,500, or nearly 4,500 counselors were involved. More than 3,000 nurses were involved. 700 or 800 doctors were involved, and about 100 ICU physicians. Again, it's only a sample. These are the numbers of the caregivers who got infected while giving care for others. More than 700 sisters, about 168 priests, and more than 1,000 lay staff were infected. We also lost some of our caregivers in this process, 25 sisters, 15 priests, and 21 lay staff. we remember them fondly. And again, these are only numbers from the sample survey. There are some of the pictures of our support PPE kit, food kits, oxygen concentrators. So that's briefly about our COVID response, and you will see much more details in our annual report, which we just released today. Let me come to the non-COVID projects that have been the long-term projects that we have been implementing from the Directorate. This is our reach in the last financial year. You can see the numbers, the people we reached, the households we covered, and the number of people we underwent screening and testing for various diseases, communicable, non-communicable diseases. The referral services, the various healthcare services we could provide. And we also could link about 4,406 people to social schemes, security schemes. That's also part of our community health work. We did capacity building, and 122 of our member institutions are part of this as our implementing partners. Coming to some of the specific projects, you can see the numbers we reached during with our community health interventions. On awareness, tuberculosis awareness, that's a specific project in collaboration with the Government of India. We support 1,364 children infected and affected by HIV. This LTBI is the latent TB intervention which we are doing. These are not active TB patients, but who are contacts of TB patients, their family members. So this was a pilot project we did, and as a result, we could move to the scale up in the second phase. That will come in the next annual report. Another focus area we have is disability care. We supported more than 50,000 people for eye care. Cataract surgeries. These are mostly cataract surgeries. We supported 7,205 children with disabilities. And we also, because of COVID restrictions, we had this digital reach project where experts reached to these children with disabilities through community-based rehabilitation workers and also the family members through telehealth services, especially during the lockdown. We supported 12 of our institutions with vehicles, with the support of MIVA. And with the University of Melbourne Music Therapy Department, we had a pilot project with children with disability, and that is making a difference in the quality of their lives. And if it works out well, we are able to scale it up if we get sufficient resources. Another focus area we have is palliative care. We have 71 implementing partners. These are mostly hospitals where there is a sister doctor, because the presence of a committed doctor is important for palliative care for legal reasons, because we also provide medications, morphine, those kind of things which cannot be handled by nurses alone. So we have a strategy of working with sister doctors, their institutions, and altogether we could support more than 2,000 people with inpatient services. And it is also a home-based model, a community-based model, where we reach out. You can see the numbers there. In addition to this, we are also involved in renewable energy. This is one of our focus. We have been working in this area for several years now. And last financial year, we could support 40 institutions with solar installations. This is helping them to save energy. And some of these places are remote places where there is no continuous electricity. So they are able to provide healthcare without interruption. Now let me come to the network strengthening initiatives. All of you know that CHAI is not only just an NGO, and that is what I presented till now as an NGO from the Directorate, what we did. But CHAI is also a network of member institutions. So we also have some network strengthening initiatives. There are several challenges. So for the sustenance on and for the growth of the network. So I'm going to present that briefly. This is the context. Now, 30 years ago, healthcare in Bangalore meant St. John's Medical College, St. Martha's, St. Philomena's, and so on. But today we know that healthcare, when people talk about healthcare, it's Narayana Hridayalaya, Fortis, Apollo. Of course, we are there, but there are new players who are coming, and they're actually taking away people who have paying capacity. Our model was a cross-subsidization model where we supported the poor people through cross-subsidization, where we could generate money from those who could afford to pay. So that is what is being affected because of these corporate hospitals or hospitals with profit motives. Now, 30 years from now, the question is, will there be CHAI? How many of our hospitals will survive? Will there be CHAI health centers at all? Now, where sister nurses work, the doctors are not available. Will there be enough priests and sisters to give leadership? These are the questions that made us to take these kind of initiatives that strengthens the network. So one of the initiatives we have is telehealth initiatives for reaching the margins. This also evolved in the context of COVID-19. We had a webinar last year, and from there, this project initiated. There will be a detailed presentation on this by John Sandosh, so I'm not going into the details here. But we had a 4 months of pilot project in 80 villages with sister nurses, sister doctors, and CHAMs or community health associates for mentoring and promotion in the villages. And that was a learning experience. From there, we moved into, we integrated that into our community health project supported by Miserio. And now it will continue for 3 years. One of the challenges in our pilot was real-time availability of doctors. So we have managed to convince some of the doctors of Jesus Youth Movement. They are a Catholic movement with a lot of volunteerism, and about 40 of them have volunteered to help the sisters to reach out to the periphery. So we are working with them, and in this phase, we'll be reaching 175 villages. If it works well, with minimum investment, with some little resources, we'll be able to scale it through our whole network, connecting villages to primary care, secondary care, and tertiary care using our vast network in this country. This is a new development. The new funding partners come forward. They're very keen on sustainability, long-term sustainability. So we are exploring the possibility of tele-ICU in peripheral areas where it's difficult to get experts like intensivists. Here we are starting with 2 of our peripheral institutions with the help of Rajagiri hospitals. Before moving to a full-fledged tele-ICU, we are starting with the daily tele-rounds, which can be, and from the learnings, we'll be able to scale it. So that's about the telehealth initiatives. We also have an initiative called Vaccinate. The purpose is to address the gaps and also for visibility. We are doing a lot of work, but many people don't know that we are doing a lot of work. So this is also the purpose is to get some visibility as well. Most of you are familiar with the vaccine dynamics in India. There was a vaccine politics, there were changing policies, and we struggled through those changing policies. There was a vaccine economics, paid versus free vaccines. So we are able to generate some donations for supporting those in the periphery with free vaccines. And one of the problems is vaccine hesitancy, and this is where the sister ambassadors are contributing much. And these projects are going on. In addition to this, we are also trying to bring CHAI Health Associates for mentoring and promotion, CHAMPs, as ambassadors who can bring more people to our hospitals. This is being piloted in 2 hubs, and organizations, reputed organizations like SLRI, their volunteers, alumni are supporting this initiative. Tech Mahindra has come forward for the training of these CHAMPs. We're also doing an individual donation campaign through Milap platform, doing it with our friends and also those clients who come to our hospitals who have paying capacity. A brief word about the vaccination scenario. This is the data from October 25. So the numbers will be slightly different now. But if you look at this graph, you can see the amazing work that has happened in India. Commendable work. We have crossed 1 billion people, immunized 1 billion people. Only China is ahead of us. If you look at the numbers in the United States and UK, the numbers are small because their population is small. But there is something which is a matter of concern here. That lighter green is those who took the first dose, and the darker green is, the second dose, both received both the doses, and the darker green is those who received only one dose. This is a gap. You can see it here in this graph. Now, when in UK and United States, the gap is not that great between first dose and second dose, people who took doses. But in India, only a few percentage of people have received both the doses. So that is one gap which we are trying to address. There is also gaps in various states of our country. Some states are doing well. You can see states like Kerala, they have achieved 90 and those kind of percentages. You can see some of the numbers more than 100. That is because of the gap between the target population, which that number comes from 2019. So population has increased, the vaccination population has increased. That's why that you can see that. But there are a lot of states where even the first dose of vaccination, there's a lot of gap, and that is another gap which we are trying to address. That's about vaccination. Another involvement for the network we have is we are trying to do telemarketing, and this is also for visibility and for increasing income, because there's a lot of financial struggle for our institutions, especially because of the COVID crisis. So we are working on quality websites. Again, some of the institutions are involved. If it works out, now we'll be able to scale it to the rest of the thing. These are some of the strategies the corporate hospitals and the profit-oriented hospitals are doing. We have to leverage technology. We have to use their management strengths. Otherwise, if we function like the way we functioned 25 years ago, we will not be able to sustain our ministry. So financial sustainability is also a concern. This is another area which we are involved in. We are trying to, this initiative of collective procurement had been going on for the past 5 years. There are some progress. We started as a manual process in 2016 in Child Directorate. 2019, we launched an online portal, Medigate, and almost 300 hospitals have registered in this. We have 400 plus vendors and 80,000 products enlisted in this. There is progress, but there are also challenges. Unless more of our institutions starts transacting through this, we will not be able to leverage the strength of collective bargaining. We will not be able to leverage the strength of data, enormous data which we have in our institutions. There are some other procurement initiatives that are happening in our network, one in Chai Kerala, one in Rupcha North, one in Northeast, and one with the congregation of the Holy Cross Sisters. These are different models which we are trying in our network. We have something called a Chai Academy, an online academy for capacity building. These are self-paced online courses. Especially, we started this in the context of COVID for ongoing learning and skill development in areas of community health, clinical skills, management skills. We also need a lot of leadership training and coaching for sustainability. All of us are familiar with the Indian Administrative Service. The same way Tata has their administrative service. So why not a Chai administrative service? Why not train our committed people in leadership skills and coaching for sustainability? Now, the last one is the role of the laity. We know that in the future, if we are not if we don't take the necessary steps now, in the future, there could be challenges related to vocations, numbers, quality, and so on. So how do we sustain the mission if we do not incorporate the laity? I'm glad that many committed people, some of them are not formally part of the Catholic faith, but in India, where there is a multicultural or multi-religious people, there are a lot of people with goodwill now who value our mission and who are not so happy with the way people are exploited by profit-oriented entities. They are coming forward to support, and how important it is for us to leverage that strength in our country. There are challenges and opportunities in the network. Many partners are excited about the CHAI network. They have not seen this kind of a network anywhere. Even today in India, this is the largest healthcare network after the government. And also the numbers, the reach to the periphery, the kind of people we serve. But then how many people are aware of our work? So this is where we talk about digital visibility, because today there's a digital world. So how do we promote our work to others, especially significant people who can join our mission? Not only receive our services, but join our mission and sustain it. There are institutions in our network which are par with modern times. They're able to leverage talents, they're able to leverage technology, they're able to work on financial sustainability. But there are also a lot of institutions that are struggling to survive. How do we promote cross-learning, interdependence? All these are part of our Vision 2030. So these are some of the things which we are trying to do. Now, decision-making is crucial, especially when leaders make appropriate decisions. It will have an impact for the future. But if we are not able to make correct decisions, optimum decisions, it will affect the future of our institutions, our network, our mission. So how do we also take decisions based on data? Now, there is enormous data sitting in our networks. There's enormous intelligence, but these are all scattered. Now, how do we aggregate it? How do we analyze it? How do we take decisions, good decisions, for the betterment of our institutions and our mission? Well, that is mostly a brief presentation of what we have been doing in our network. I would like to spend a few more minutes in gratitude, especially for all those who have been contributing in the past and in the present. There is a saying that we may look big because we are standing on the shoulders of our predecessors. That is exactly what CHAI is. If CHAI is big today, or CHAI is a great organization, it is not just because of the people who contribute currently or at this point of time. It is because of the hard work of all those who have contributed in the past as well. So I just want to quickly acknowledge them. Let me start with a quote from Pope Francis. To arrive at the point we have reached today, there has been a long history, a remarkably long history. And that is the strength of our Catholic network. These are some of our former presidents, to start with Sister Dr. Mary Glowry, great figure. CHAI was initiated under her leadership with 15 other sisters. I would say daring women, great women. And then we had Mother Kinsberg, Sister Mary Peter, and the first Indian president, Sister Mary Ancilla. You can see Sister Mary, Rosemary, Sister Dr. Stella. Unfortunately, Dr. P. Cherian's photo we don't have. Father Lawrence Totem, Father Matthew Chakalical, Father Ferdinand Kavil, Father John El Norona, Sister Dr. Marietta, she's still alive. Sister Martin Malikil, she's still alive in her 90s. Sister Mercy Abraham, all the rest of the people are still alive. Sister Dr. Vijaya Sharma, Sister Cleistus Daisy, some of them are attending this meeting. We will pin them as soon as I finish this. Father Julius Arakel, I need to thank him specially because he's the one who narrowed down to me as the director of Chai. Sister Dina, she was the one who gave me my first appointment letter. And after her came Sister Victoria, who welcomed you. And she's the one who gave me the extension for the second term. So I'm grateful to all of them, all their contributions, and also giving me this opportunity to be part of this great organization. Those were the presidents, and we have some of our former directors. Father James Tong, he was a Jesuit, a missionary in India. Father Emmanuel Pallikunel, Father Peter Remigius, who later on became the Bishop of Kotar Diocese, Father Bernard Morris, who became the Archbishop of Bangalore Diocese, Father John Vatamattam. He was there in Chai for about 15 years, guiding as the director. Father James Kulas, Father James also is attending this meeting. I saw his name. Sister Ansi, Father Sebastian Oseparambil is attending. Father Tommy Thomas, my immediate predecessor. Unfortunately, he's not able to join. He is in US now. And that, with those who are the past people who contributed, leaders who contributed and sustained Chai. We have the current board members. Now you have seen Archbishop Malavar, you heard him, our ecclesiastical advisor, Sister Victoria, our president, Sister Bhavya, Father George Kanantano, Father Julius Arakel, Father James Raj, Sister Mercy, Sister Lissy, Father Kiran, Sister Bina Varghese, Sister Lissy, Sister Suchita, Sister Antonia, Sister Arokya Mary, Sister Daisy, Sister Anselm, Sister Sharia Pushpam, Father Thomas, Father Binu, Sister, these are all the presidents of the regional units, Sister Teresa Lekara, Sister Antonia, Sister Denin, Sister Gerald, Sister Nirmala, Father Simon, who finished his term, and Father Shijo, he is also present for this meeting, Father George and Father Sebastian. So remember the past with gratitude. Live the present with enthusiasm. Look forward to the future with confidence. This is a quote from St. John Paul II. He was known as the prophet of hope. Wherever he went, he told people, do not be afraid because God is with us. He went through all the turmoil of the Second World War, all those problems, but he always, he spoke about hope. And that is what I would like to conclude with. We have challenges, we have difficulties, we go through tremendous distress, but in the midst of this, the invisible hands of God is with us, and the visible presence of our friends are with us, and God helps us through them. Thank you, and thank you for your patient listening.
Thank you, Father Matthew, for this update on the immense work that Chai is doing, both qualitative and quantitative, under the challenging circumstances of the pandemic, and for identifying the gaps and challenges that Chai is looking to fill and provide compassionate and quality healthcare to people on the margins, especially those living there. It is also heartening to see the plans that you have for the future for the sustainability of Chai member organizations. God bless you and the team at Chai for all that you have been able to achieve over the past year.
And Anivinda, I'm sorry, I should acknowledge my team here. I won't say they are the perfect team, but we have a reasonably fantastic team. They all go through a lot of distress, but they all sustain this organization. Thank you for all of them, yes.
We will have the launch of the Chai Academy now.